Welcome to Adapt NCLEX. NCLEX is a safety exams. There's some medications they may ask you about safe administration. I have 11 of them. These are medication you should never push through IV. I'm going to tell you why, how it should be given, and what is safe medication based on subscriber requests. Are you ready? Let's get to it. I'll give you the medication, then we'll do some questions to synthesize everything for you. Let's get to it. First, this was the question that was given to me by a subscriber. And next, preparing to administer Promethazine. Which actions are appropriate? Select or apply. Avoid IV push administration. Administer deep subcutaneously. Monitor IV site closely. Give rapidly for nausea relief. Dilute and infuse slowly to prevent hypotension. I want you to think about this question. Stop the video. Put down your answer, and then we go through the lecture, very short information. Then we do the question. We'll come back to this question in one of the questions. Think about it. Once again, pause the video, select your answer. It's a select or apply. You don't need to pick everything. Pick those that you're 100% confident. But I can give you some clue. Promethazine is a medication for nausea. How do you give it? Safe medication administration. This is pharmacology for nursing students and the NCLEX. Fundamentals apply to it. How do you answer this question regarding safe medication administration? Never give IV push. That's one clue, but there's other things you need to know. Have you picked your answer? Thank you for doing that. Now stick around. Let me give you 11 medication. Pharmacology is the same pharmacology you may learn. I'm giving you everything about our medication, and then you'll be able to answer any question regarding safe medication administration. Why do we worry about IV push? This is the reason why. If you give IV medication, it's right in the bloodstream. It's doing the job it's supposed to do. There's no margin of error. Patient can get sick quickly. Therefore, there's certain things we do in a safety precaution regarding this medication. This is the thing. They can cause cardiac arrhythmia, respiratory depression. It can cause tissue necrosis through the IV, and the patient can die. Therefore, we need to give it through certain means, not through IV push. For the NCLEX, 4 things I want you to remember. If the medication affects your heart, it affects your blood pressure, you're going to affect your electrolyte, and it's a vesicant. IV push should immediately make you think twice and don't pick it. There's some situation you may have to do that. But unless the question say that, ignore it and move forward. This is the thing. If the question does say this is a code, IV push is okay. ACLS, IV push is okay. Provider administer the medication, IV push. You must assume that it's returned if it doesn't say that. Those are the key facts. Don't forget about them. First medication, heparin. You know that. This is anticoagulation. Used for anticoagulation. Therefore, you're going to bleed. High risk of bleeding. Never give IV push. How do you give it? Through a pump. Infusion. We got to titrate it. And if it's a sub-Q medication like enoxaparin, give it to the patient. The caveat, you can give it through IV push. Which one? Tiny flush. You can do that. If you flush in a central line, you can give it through a tiny flush. If you say that, pick that answer choice as right. Or 2, if you say provider directed protocol, there's some hospital protocol provided by the providers that you can provide to the patient by giving IV push. If the question does not say that, titrate it, give it through a pump. Or if it's an enoxaparin, IV means. And these are the things, because you got to monitor PTT so that you can titrate it. You got to monitor for bleeding. Why do you want to give your IV push? And therefore, infusion is much better. Next medication, electrolyte, magnesium. You use it for what? Preeclampsia. We want to prevent you to having seizure. But it's a medication that drops everything down. I call it the 3 hours. You see what I mean? Respiratory depression, hypotension, and cardiac conduction. Therefore, what is it going to do? It affects all these organs. Therefore, what do you do? Slowly, over 10 to 20 minutes. What are the things you should look for? These are the 3 R's. If you don't remember anything about magnesium, I want you to remember the 3 R's. This is the major side effect. 1 R, respiratory rate, depression. Your reflexes go down, areflexia. Your renal, kidney, urine output is low. So magnesium, 3 R's are your brother and your sister. When you hear it, think about it as the key aspect of this medication. This is why you don't give it through IV push. Dilantin, classic medication. They can ask you which of this is true, which of this is safe to do. It's a seizure medication. It causes severe hypotension, bradycardia, and life-threatening cardiac arrhythmia. You should never give it through IV push. Why? Because it causes problem. Therefore, don't do that. Control the infusion and give it through what? A filter, IV, large one. You should never give more than 50 milligrams per minute. That's very important. If you give it more than that, you're going to have all the signs and symptoms I've indicated about. You need to verify the concentration. You need to give it through IV pump, and you need to monitor the cardiac rhythm. Potassium. This is common medication because of cardiac effect. It can cause cardiac arrest. Very easy. This is why we use it in bad situation. When they push this on you, you're going to die. You need to dilute it, administer it through central line, and don't go more than 10 milliequivalent per hour. Note that number, 10 milliequivalent per hour. That's NCLEX key. Stop that one and then write it down. You need to verify the concentration, pump, and then monitor the individual. Cardiac monitoring is needed. Iron is a simple medication most people does not think about, but it's very, very bad when giving IV, especially push. It causes hypotension and severe hypersensitivity that can be life-threatening. Therefore, slow as much as possible and dilute the medication. Monitor them for hypotension and signs of anaphylaxis. Don't forget, anaphylaxis and hypotension is the key for iron. Vancomycin, we all know, red man syndrome. Yes, there's a reason why. Red man syndrome, flushing, and hypotension is an hypersensitivity, not an allergic reaction. You need to slow down the infusion. That's why you should never give by IV push, because if you give by IV push, you can never slow it down, and they will lead to red man syndrome. So slow over an hour, 60 minutes, and then monitor the blood pressure infusion rate. Remember, this is not a vesicant. It's an irritant. Irritate the vein, but it does not act like a vesicant. People get confused. It's an irritant, not a vesicant. There is different. Promethazine is a nausea medication. This was the medication we saw in the first question. What were your answers? And this is the key, right? Severe necrosis is a vesicant. Because gangrene, we may have to amputate your leg. Therefore, we may have to amputate your leg. Therefore, pay attention to that. Very, very important. Never give by IV push. How? Slow as much as possible. But the best means is IM medication, deep IM. You should not give it through any route than IM. But if we want to give it through IV, then slowly as much as possible. Therefore, you got to monitor IV site, and then I said, make sure the patency of the IV is okay. If you have a choice, if there is a question and you have a choice, patient need promethazine, and there is IV and deep IM, pick deep IM. Vasopressin, you know, is epinephrine, no epinephrine. All those things can cause your blood pressure problem, can cause perfusion issue, can increase your blood pressure. Therefore, give it through central line, not peripheral line. If you don't have central line, just give it through peripheral, but slow as much as possible and put the patient on a cardiac monitor. Safe medication administration. Medication never to give IV for the NCLEX Pharmacology, nursing pharmacology for nursing students. That's what we're doing. Living medication, living drugs. Now, Amiodarone, you know, this medication is used for ACLS. If it's not ACLS, then don't use it as IV push because it causes heart block, bradycardia, hypotension. The only means you can use it IV push is ACLS. Control infusion as much as possible. and then patient on a cardiac monitor as usual. Chemotherapy agent are the biggest vesicant. Cause necrosis. They can cause so much problem to the patient. That's why patient is in the hospital for almost an hour or the whole day to get infusion through a central line. Most of the time, it's through a central line, never through a peripheral line. But if you have a peripheral line immediately, yeah. But most of the time, central line is always preferred. That's why they give it to them. There's some situation it may need IV push. That's what we call protocol-based administration. If you see protocol-based administration, they're referring to fast administration. But the word protocol saves you from harm because there's a protocol for that. You need to verify it. You need to check the IV access. You're going to monitor the infusion. That's why patients stay in the hospital for a long time, more than 6 hours when they're getting chemotherapy. Those drugs are dangerous. Calcium, notorious. If you need calcium, an electrolyte, and you give it too fast, bradycardia, cardiac arrhythmia. Therefore, they also causes tissue necrosis. You got to be careful about it. These are medications. I feel like based on the question, I got to put it together so the next time you see them, never pick it. How do you give it? Slow as much as possible. If there's emergency like ACLS, sometimes we got to give you calcium to help with your heart. Or after you get blood transfusion in emergency or cardiac code, yeah, we give you IV push. Because of that, monitoring and checking your IV patency is very, very important. These are 11 medications you should be comfortable with. By the end of this video, I know you've got it. Now, let's look at a few questions. We're going to apply them, and I want you to pay attention to them. Before that, this is the key. This is the memory thing. If you don't remember anything, I want you to remember this. If the medication affects your heart, your blood pressure, your electrolyte, or it's a vesicant, think about it as a pump medication. Do not push. Once again, heart, blood pressure, electrolyte, and vesicant, never push. It's a pump medication. Now, let's look at questions. We are applying them. Which finding require immediate intervention? During magnesium sulfate infusion, select or apply. Respiratory rate of 10, absent deep tunnel reflexes, urine output of 20, blood pressure 118/76, and lethargy. What do you think? Stop the video, pick your answer choice, and let me know what you think. But this magnesium is used for preeclampsia. Patient is getting that. I told you drop everything. Have you select your answers? It's a select or apply. You don't need to pick everything. Pick those that you know you're confident. But I told you about the 3 R's. You pick your answer. I know you pick your answer. Stop the video and select your answer and keep your score. 1 R with respiratory rate less than what? 12. That's a problem. 10 is bad. You have no reflexes. Another R. Good. Your urine output is less than 25. Good. This blood pressure is normal. Lethargy is NCLEX trap. NCLEX will trap you with that. Forget about it. If I give you magnesium, I told you everything is going down. You're going to be lethargic. You're going to have fatigue. You're going to be drowsy. Unless the word, there's a qualifying here. It said increasing lethargy, increasing drowsiness, increasing fatigue. That is a bad problem. Unless they say something in front of it, you should never pick it. This is key. Next question. And nurse is preparing to administer promethazine. This is the question we saw. Based on the content, I know you know something about it. Which actions is appropriate? IV push, administer deep subcutaneously, monitor IV site closely, give rapidly for nausea, dilute and infuse slowly to prevent hypotension. What do you think? Based on the lecture, what do you think? Do you select your answer? I want you to select your answer. Then you listen to the way I'm going to approach it. Keyword, promethazine. Another keyword, select or apply. Don't over-select. Which action is appropriate? What do we say about this? Number 1 is a vesicant. If it's a vesicant, you should avoid IV push. You should give it IM. I told you deep IM. That means not subcutaneous. Wrong answer. You should monitor IV site if that's all you have. That's the key. Just because they have nausea, you should not give it rapidly. You said, have you avoid IV push? Why would they give it rapidly? You should dilute it and infuse it slowly, but it does not cause hypotension. I said it's a vesicant. It causes necrosis. Just because I put hypotension there, you should not pick it. So 1 and 3 are your right answer. These are the key things I want you to pay attention to. Which medication require cardiac monitoring? That means it affects your heart. During IV administration, selected apply. Amiodarone, Vasopressors, Magnesium sulfate, IV ion, and what? Vancomycin. Which one affect your heart and you need cardiac monitoring? What do you think? Select your answer. As usual, pick your answer choice. Cardiac monitoring, IV administration, amiodarone. It affects your heart block. Vasopressin affects your heart, causes vasoconstriction. Magnesium, it affects the conduction system of your heart. Iron and vancomycin does not do that. Those are the right answer. 1, 2, 3. So, like I said, I make the question straightforward, but at the same time, so that you can consolidate the information you learn. Which complication may occur when I give you vancomycin rapidly? Select or apply. Redman syndrome, severe hypotension, tissue necrosis, bradycardia, and flushing. There's certain things about answering questions. That just because the condition is bad doesn't mean you should pick it. If it does not answer the question, that's what I want you to take from. So what do? Vancomycin, rapidly. Select or apply. What do you think? You pick your answer. Like I said, I always say stop the video, actively pick your answer, then you play. Of course, hypersensitivity, Redman syndrome. It causes hypotension. It's not anaphylactic. It does not cause tissue necrosis. I emphasize that. It's an irritant, not a vesicant. It can irritate the vein, but it does not cause skin to die. It does not affect your heart, no bradycardia. It can cause flushing. So 1, 2, and 5 are your right answer for this question. Of course, potassium. I cannot leave without asking you a question on potassium. And next question, an order for IV push potassium. Which rationale support this? Select or apply. Why did the next question this order for IV push of potassium chloride? Risk of fatal arrhythmia, required dilution, causes respiratory depression, must be given by IV pump, high alert medication. Why do you think this nice nurse who knows her stuff tell the doctor, I'm going to question you for IV push? Stop the video, let me know. Stop the video, pick your answer. You can put it in the comments and let me know. Why would she do that? What do you think? It's because she knows that what? Potassium is an high alert medication. It should be given by a pump. It does not affect your respiratory rate. We need to dilute it in a saline, and then it causes arrhythmia. All are correct except number 3. Did you get that right? I know you did. Which medication are considered vesicant? I cannot live without telling you no which one are vesicant. That means they causes necrosis. Out of the 11 medication we talk about, which one causes necrosis? Is it promethazine? Is it iron? Is it vancomycin? Is it potassium chloride? Is it magnesium sulfate? What do you think? We saw this already. Promethazine, out. Iron 2 is a vesicant. Vancomycin, I say, is an irritant. Magnesium is not a vesicant. Potassium chloride is a vesicant. 1, 2, and 4 are your right answer. Are you keeping your score? And let's receive an order for IV iron infusion for a client with hemoglobin of 6 grams. So this is 6 grams. 6 grams per deciliter. That's what the hemoglobin is. This is the order the nurse receive, right? 6 grams per deciliter. Which action demonstrates safe administration of iron? 6 grams, very anemic. How do you give iron? Just because the patient is anemic doesn't mean you should just give it to the patient just like that. You need to follow certain protocol. That's what the question is asking you. Do you monitor for hypotension? Do you dilute the solution? Do you give IV push for the anemia? Do you observe for hypersensitivity? Do you give it through central line? What do you think? We saw it. We know iron is a vesicant. I give you a clue, right? Therefore, what would you do? What would you do? The last question. What do you think we should do? You pick your answer. Don't get trapped because it's hypotension and severe hypersensitivity reaction. You need to dilute it. It's a vesicant. Just because it's an IV, we should not give it to, you have anemia, we should not give it to IV push. And this is a trap. You don't need a central line to give it to. Safe medication, 11 medication with NCLEX practice question, NCLEX question and answers, NCLEX review questions for nursing student, pharmacology, 11 of them. Which one you should administer safely? No IV, how to administer it, certain things you're supposed to know. These are fundamentals of medication administration. At the same time, pharmacology for nursing student and NCLEX and ATI and SC. Thank you for watching, and I hope you get 8 out of 8. Thank you. You have a good day. All the best of luck. And if this video help you, check the screen. I'll put another at the end screen. There's a playlist on pharmacology to master it and another medication on safe medication administration. Thank you and good luck in your exams. Bye.